Good evening. Today is June 15th, and today I'm continuing to be talking about the coronavirus. So the first piece of news that I'd like to talk about is Africa. In Africa, porous borders and haphazard health efforts are complicating efforts to stop the spread of the virus. For months, many African nations managed to stave off, or at least slow, the spread of the coronavirus, partly by closing borders early and banning public gatherings. However, the virus is now racing across Africa, aided by public health measures that are being applied haphazardly or not at all. At a Central African Republic border town this week, dozens of truck drivers have been tested, but in the meantime, ordinary people drifted back and forth across the border, often unchecked. When the authorities did pull over a bus for a spot check as it neared the capital, one passenger who tested positive was sent to a hospital, but the conditions were so bad there that he ran away. Last week, the WHO said Africa's confirmed cases had doubled in 18 days to reach 200,000, and I think right now Africa needs to intensify its efforts to slow the spread of the pandemic. I think what is the complicating measures in here is that there is a catastrophic shortage of health professionals and medical supplies, which will not be easy to gain in Africa to try to help slow the spread of the virus. And even basic safety measures are sometimes being ignored. So I think what can we do for Africa is that, one, its citizens and the general public has to realize the dangers of the coronavirus, and they have to start social distance. They have to follow basic safety measures that should be implemented by local health officials more, and to prevent people from getting sick and going to hospitals with bad conditions. So I think more testing should be done, and also in Africa there's another problem where many other diseases are also spreading in Africa, and out of the coronavirus, I think the countries are not going to be able to survive it. So just start from the basic safety measures and try to help as officials work upwards and try to improve conditions in hospitals. The second thing that I'd like to talk about is that a new modeling study published today in the Lancet Global Health has said that roughly 1.7 billion people around the world, 22% of the global population, fall into a category that they are the most at risk with underlying health conditions such as diabetes and diseases. And the coronavirus has stricken nearly 8 million people in just 6 months, and at least 434,000 have died. These deaths have not been distributed evenly and are targeting the most vulnerable, which the new modeling study has showed in the estimate. While this estimate excluded healthy older individuals without underlying health conditions, a group also known to be at risk of their age, it also did not take into account risk factors like poverty and obesity, which can influence a person's susceptibility to disease and access to treatment. However, even if it excluded these populations, this data could help health officials focus containment efforts on people vulnerable to the virus's most dangerous effects, and perhaps eventually prioritize them for vaccination, so that this can be to prevent them from developing serious conditions or even dying. I think this is really helpful in that as we better understand the coronavirus and the numbers involved, we can help prevent the disease from spreading to them, and like I shared before. But also take in mind that even if you're not at risk, you should still be careful, because healthy people can develop serious effects by the coronavirus. And also, if you could also spread it to people who are vulnerable. Unknowingly, if you were asymptomatic, you could and they could develop serious effects. So just try to stay safe no matter if you're at risk or not, and just try to stop this pandemic. And that's it. Thank you for listening, and I hope you have a good day. Thank you.